Hello, I'm County Judge Houston Wells. Welcome to County Connections. Today we have two very important people in Frankfort and Franklin County to talk a little bit about the coronavirus. We have Brittany Parker with the Franklin County Health Department and Tommy Russell with Emergency Management here in Franklin County. Welcome you all. I'm sorry that we're here under these circumstances, but a lot is going on. Today is March the 12th. And this will be going out real soon, but who knows what's going to happen 1 week from today. But let's get on top of what's happening here in Frankfort and Franklin County today. Brittany, tell us a little bit about what is going on across our state, and then let's talk about our community.
All right. Yes, sir. Thank you for having us. The Franklin County Health Department has been working with public health officials, state, federal, our emergency management team for weeks now, preparing for the coronavirus to come to Kentucky and potentially Franklin County. To date, we do not have any positive cases in Franklin County. However, we are preparing. We want to be prepared for if we do get that positive case.
Yeah. So that leads to an important question that I know that the audience wants to hear. All right, let's say that you have maybe a flu-like symptom. So where does someone go? What are the thoughts from the health department standpoint on just having a symptom that is very similar to coronavirus, maybe or maybe not coronavirus?
Absolutely. So what we've been telling folks whenever they call is that we do want you all to call. There is a 1-800 number for all of the community to call at the state. It is 1-800 722-5725. They will direct you. They will have a series of questions for you, direct you in the direction that you might need. Also, call your healthcare provider before you show up. They can screen you over the phone, maybe have some guidance for you on if they think it's flu-like symptoms, is it coronavirus, or whatever your symptoms may be. But definitely call your healthcare provider before you show up, or the emergency room before it is you do walk in their doors, so they are prepared and can kind of triage you before you get there. However, what we are telling individuals is if you would not normally have sought care before you heard the word coronavirus, then don't seek care right now. Don't overburden the healthcare system. They are working tirelessly right now on this pandemic. Or if you really do think you have coronavirus, please give them a call before you show up.
Yeah, I think, Brittany, I think it's very important that we reiterate that if you're feeling the symptoms and you're concerned, that you make a phone call, and you have given that phone number again.
Absolutely. It's 1-800-722-5725.
You call that number, or you call your local healthcare provider and talk with them. Do not, if you're having these symptoms, go into the doctor's office, nor go into the emergency room, unless it is absolutely an emergency. But let them know before you go in, because remember, if you have it, this is a highly contagious disease at this point in time, or virus at this point in time. So another thing that people are wanting to know is, what do we do to keep from getting it, because it is so contagious?
Yes, so this is our public health message for everything. We've been preaching this message for years. Let's wash our hands and wash them well. This isn't just washing your hands. We're using proper hand washing. We're washing them for at least 20 seconds with warm soap and water. And why don't we just go ahead and double that for 40 seconds? Sing your song one more time while you're washing your hands. Clean and disinfect those areas that are commonly touched or that you use frequently at home, in your workspace. Clean your cell phone often. I mean, how many times do we touch our cell phone in a day? So definitely let's clean your cell phone, clean your office phones, and for businesses themselves, clean as often as you can. I understand that it can't be done maybe between 4 times a day, but clean as often as you can. while we're working through this the next little bit. Also, practice social distancing. So when we talk about social distancing, we're talking about standing 6 feet away from individuals that when you're out in public, just trying to, stay 6 feet away from people. Cover your cough and your sneezes. Do the dab. Then wash your hands after you do that, definitely. Also, stay home if you're sick. That's really important right now. Stay home if you're sick. Stay home if you're not feeling well. Keep your kids home from school if they're not feeling well during this time. And also just avoid contact with those that are sick as well.
Very good advice. Very excellent advice. Tommy Russell, first of all, let me say, by the way, thanks to both of you. Thanks to the Health Department, and thanks for you, Tommy, for your great work with Emergency Manager. You have been behind the scenes working diligently with all kinds of organizations. And we've had several organizations that have either shut down or their services have been changed quite a bit. Tell us a little bit about, as much as you can, about what is happening in Frankfort behind the scenes. What are you dealing with from the emergency management standpoint?
Right, yes, sir. As Brittany said, most of the play right now is on social distancing. Avoid large crowds. You know that this virus is extremely dangerous to those people that are over 60 years of age. The younger generation has a tendency to recover better, just like they do from everything else. So for my agency, we had a set of questions out that E911 was asking people if they called and had flu-like symptoms. We've had to go through several drafts on those questions as the virus gained strength in the United States. And eventually it came to the part where we didn't even have to ask if you had traveled outside of Kentucky, now that we have 8 confirmed cases in the state. So 911 knows what questions to ask. Those answers are transferred to our first responders, and then they respond appropriately, whether they have to put on extra personal protective equipment or they think that it's not an issue. So if somebody sees somebody that has on a gown and mask and hood and all of that kind of stuff, it's just a precaution so we can protect our employees. I have talked with you many, many times, with the mayor many, many times. I've talked to both governments, our governing bodies, to try to protect our employees. The one thing we don't want is for one of our workers to contract this and to bring it into our workforce, which would be detrimental or really create a significant danger to continuity of government. I have counseled on large groups, many different agencies, and I actually have a meeting. Will this be out tomorrow?
Not tonight.
Okay. I actually have a meeting with all of my long-term healthcare facilities tomorrow in the Emergency Operations Center at 3 o'clock to see what their plans are. I've tried to identify essential personnel for all of our staffing and responses and how to keep things functioning as normal as possible through this event.
Mm-hmm. So as you talked, and thank you about talking about our employees and protecting our employees, we want to make sure that everybody understands we're going to do the very best we can in making sure that all local governments stay open and provide the services to the best of our ability to the constituents in Franklin County. However, there's a change that we're going to announce, or that we're announcing today, which will be taking place ASAP, and that is, as Tommy mentioned, there are things that can affect, that can spread the virus very quickly. One of those things is money. The exchange of dollar bills carries the germ for, we're thinking now around 72 hours on dollar bills. So for this time being, we're announcing that starting tomorrow, which is Friday the 13th, unfortunately, Friday the 13th, the county clerk, the fiscal court, the PVA, planning and zoning, the occupational tax administrator, business license in Franklin County will not be accepting cash. And that is for several reasons, but most importantly, it is to protect our employees from the virus, because that can stay on a dollar bill for approximately 3 to 4 days. So we're going to do everything we can to help you with whether if you would bring a check, that would be great. If not, we will have, to the best of our ability, a credit card machine. Even though I want to warn you, there may be an additional charge if you use that. But any time you need our services and you're coming in to pay, please make sure that you bring a check at this point in time until further notice to protect our employees from getting the virus. Tommy, let's go back to just a second. That, my goodness, I have never in my life seen such change in the NBA has canceled the rest of the year. The state tournaments are changing. The conference basketball tournaments are changing. No fans. Why is all that happening?
That's just, the virus, because it is an unknown, and Miss Brittany will attest to this, we don't know what's going to happen with this thing. As it's been so fluid, it's changing every day. We are altering, and you know that as well as I do. We've talked and talked and talked. We're changing protocols every day. So with the SEC tournament being canceled, ACC, all of those tournaments have taken the necessary precautions to protect the public. When I say that, that means social distancing. You can't bring 60,000 people together, and especially with an elderly population, expect them to walk away from there
and not be exposed.
That's correct. We're trying to limit exposures for all of these groups, and it's going to happen here in Frankfort. Some of the big events that we may have to cancel. It just depends on how this plays out. And I take most of my guidance from Franklin County Public Health and from the governor's office, what the information he relays. So Franklin County Public Health, CDC, is where I get all of my not all of my information, most of my information, and I lean on them strongly, and they've been a wonderful partner for me.
They have been a wonderful partner. Brittany, if you don't mind, to our audience, please go back over if you're feeling not good and you have some concerns, what should somebody do?
So if you're not feeling well, call your healthcare provider, or you can call the 1-800 number that the state has already set up for the community, and that's 1-800-577 or 722-5725. Let me repeat that, 1-800-722-5725. Additionally, there is a website that you can get all the information about the COVID-19 in regards to what it is here in the Commonwealth and the steps that we're taking, and that is kycovid19.ky.gov.
Brittany, thank you. Is there anything else that either one of you would like to say to the public during this time?
I would ask that the public bears with us on this. Mm-hmm. This is not like a flood or a snowstorm or anything else that we've ever been through. So a lot of this information, we're learning as we go. Absolutely. Pretty much. So we're putting it together kind of on the fly, even though we've got pandemic plans for everything. This is just a different animal altogether. So there are going to be some inconveniences in the public and to the workforce. Everybody, please bear with us, and we'll get through this.
That's well stated, Tommy. Thank you.
And I also I heard on another webinar today the 3 C's: stay calm, be clean, and be cooperative. And I think that's a great public message right now.
The 3 C's. Thank you. Calm,
clean, and
cooperative. Okay. Thank you both. It is a pandemic. It is something, rightfully said, Tommy, that we're not used to this. This is not normal for us to deal with. We have dealt with floods. We have dealt with snowstorms. We have dealt with tornadoes a long time ago, but storms. This is different, and this is different. Mainly where it's affecting you and us as a community is today is March the 12th. Who knows what's going to happen in 7 days, March the 19th. We just don't know. In 7 days, we have gone from having no cases to to eight cases.
8 positive cases.
And all kinds of things are happening in a week. So a week is lots of things that can happen in a week. So we ask that you be diligent, listen to the words that were said today, and we're going to do everything we can from the Franklin County Fiscal Court, the City of Frankfort, and everybody else in this community to make sure that we get the word out to you, what is going on. Also listen to the governor and to our health department, because we're doing everything we can to make you aware of everything that's going on. Thank you for watching. We hope that you like and share our program. Thanks once again for watching County Connections.